I am Rushali Khajuria. My topic is PFT changes in obstructive and restrictive lung disease. Pulmonary function test is useful to assess the functional status of the respiratory system both in a physiological and pathological condition. The lung function tests are based on the measurement of volume of air breathed in and out in quiet breathing and forced breathing. It divides into the two, static lung function test and dynamic lung function test. Static lung function tests are based on the volume of air that flow into or out of the lungs. It includes the lung volumes and lung capacities. The static lung volumes include the tidal volume, inspiratory reserve volume, expiratory reserve volume, and residual volume. The static lung capacity, it includes the inspiratory capacity, vital capacity, functional residual capacity, and total lung capacity. The second one is the dynamic lung function test. It is useful in determining the severity of the obstructive and restrictive lung disease. It includes the forced expiratory volume, maximum ventilation volume, and peak expiratory flow. Let's see the obstructive and restrictive lung disease. First is obstructive lung disease. It is a condition characterized by increased air resistance to the airflow, particularly during the exhalation due to the narrowing of the airway or a blockage of the airway. Causes is COPD, chronic obstructive pulmonary disease, asthma, bronchiectasis, and bronchiolitis. Second is restrictive lung disease. The condition that limit the expansion of the lungs, that causes a decrease in lung volumes and lung capacities, causes interstitial lung disease, gestational disorders like kyphoscoliosis, neuromuscular disorders such as amyotrophic lateral sclerosis, pleural disease like pleural effusion, the condition that limit the expansion of the lung, which lead to decrease in lung volumes and lung capacities, they are known as restrictive lung disease. So let's see the PFT changes in obstructive and restrictive lung disease. First is total lung capacity. It is a combination of two or more lung volume. It's normal in the obstructive lung disease due to the hyperinflation, or the total lung capacity is decreased in the restrictive lung disease because of the limitation of the chest expansion, or there is a decrease in chest expansion. The second is forced vital capacity. It is a total volume exhaled forcefully after the full inspiration. It is known as forced vital capacity. It is a normal or a decrease in obstructive lung disease because there is some air is trapped, so less exhalation. Or the forced vital capacity is decreased in restrictive lung disease because there is a decreased lung capacity due to the limitation of chest expansion. Third is the forced expiratory volume in 1 second. So it is the volume of air which can be expired forcefully in given time. So here it is for 1 second. It is a decrease in obstructive lung disease because some air is trapped, so there is a less exhalation. Or in the restrictive lung disease, the forced expiratory volume in 1 second is a normal or a decrease because there is a low lung volume. And the last is FEV1/FVC ratio. It's decreased. It's less than 0.8 in obstructive lung disease, or it's a normal or increase in the restrictive lung disease. Thank you.